Hello, my name is Josh Neese. I'm a psychologist, and today I'm going to be talking about the autism spectrum. So I'll be talking about some definitions of autism spectrum, some theories and different thinking styles, and asking the question, is autism spectrum a difference, not a disability? So the National Autistic Society defines autism spectrum as a lifelong developmental disability that affects how a person communicates with and relates to other people. It also affects how they make sense of the world around them. The DSM-5 is a manual that we use to help us diagnose different illnesses and disorders, and it has some particular criteria for a diagnosis of autism spectrum. So impairment in social communication and interaction, restrictive repetitive patterns of behaviour, interests or activities, including behaviour related to sensory sensitivities. Symptoms must present in early childhood, but they may not be obvious until the social demands exceed that child's capacities. And autism spectrum has to affect that person's day-to-day functioning in a significant way. So there's lots of research to say that there are a great many people in the population with traits of autism spectrum, but whose difficulties don't affect their day-to-day functioning. Children with autism spectrum might have a delay or a lack of language development, and this can vary greatly from children having a very low level of language ability. Some children might be non-verbal, single words, have phrase or fluent speech. They might also use language in an unusual fashion, and this might include stereotyped, repetitive, or idiosyncratic. It's a very kind of specific to them language. They might use echolalia, so they might repeat immediately words or phrases that they've heard, or they might have delayed echolalia, so repeating things that they've heard from the television or from something that somebody else has said, and repeating that in a way that doesn't quite meet the social context. They might have difficulties with understanding sarcasm, irony or jokes when they're that bit older, and they can tend to take things quite literally. They might have difficulties with the pitch, tone and melody of speech. They might have difficulties using a very sing-song prosody in their speech. People with autism might have difficulties in initiating or starting off conversations. They may also have problems maintaining conversations. They might have difficulties with using a socially acceptable amount of information in conversation. They might have difficulties keeping on topic, and they might have a propensity to keep steering the topic of conversation to an area of their special interest. They might have difficulties volunteering information in conversations, and they might have difficulties with the to and fro of conversation and might either dominate a conversation or might have difficulties giving any information. Children with autism spectrum also have difficulties communicating non-verbally, and they might have difficulties, for example, using eye contact, communicating with their facial expressions, their body postures and gestures. They might have difficulty sharing enjoyment with other people by looking at them and using their facial expression to communicate their amusement at a particular activity. They might have difficulties showing, bringing or pointing at objects of interest. And they might generally have a lack of social interest and ask fewer social questions. They might have difficulties developing appropriate peer relationships and friendships, and socialising might not come naturally to them. Children with autism spectrum might develop rigid routines and rituals, and this might provide them comfort and control in an unpredictable world. They might develop stereotyped and repetitive motor mannerisms, so they might engage in things like hand flapping or looking at things unusually from the corner of their eye. They might have special interests which become all-encompassing and get in the way of their day-to-day lives, and they may experience a number of sensory sensitivities which might vary from a sensitivity to loud noises, or it might include textures, tastes of foods, a sense of where they are in space, etc. Autism spectrum is a pervasive developmental disorder, which means it doesn't go away and it affects how children grow up. It's also a social communication disorder, meaning it affects how people understand others and are understood, how they function in their day-to-day lives, communicating and interacting with other people. It's also a neurodevelopmental disorder, meaning that it affects the brain and how it develops. We used to have this idea of the autistic triad of social communication, social interaction and social imagination. What we've learned through the research is that it's very difficult to unpick the difference between social communication, say, and social interaction, and therefore it's better to combine all of these ideas under the heading of social affect. We also have our repetitive and stereotyped behaviours, and our most recent manuals have included sensory processing as a part of the diagnostic criteria. And you might have heard a great deal of variation in the language used to describe the autism spectrum. So previous to our most recent manual, there was a difference between autism and Asperger's syndrome, and this was used to describe a specific part of the population who were, in terms of Asperger's, high functioning and quite intelligent, but with these clear difficulties with social communication, interaction, restricted and repetitive behaviours. Some of these children had an active social style but came across as quite unusual in the way that they interacted with people, and people with autism who tended to be described as children who also had intellectual or learning disabilities. Again, what the research has shown us is that actually these different difficulties are very much on a continuum or spectrum, and it's very difficult in many ways to make a differentiation between people who have traits of autism spectrum and people who meet the criteria for a diagnosis of autism spectrum. And equally, it's very difficult to say, where does Asperger's start and autism end. So to avoid some of these difficulties, we simply refer to it as autism spectrum disorder. Some people, particularly locally in Kent, use the term autism spectrum condition because they feel that this is less pejorative. However, the manuals use the term autism spectrum disorder, and personally I prefer to simply refer to it as the autism spectrum. You may also hear the term social communication disorder, which is used both as an umbrella term for children who have social communication difficulties, and also a specific description for children who have difficulties with social interaction and communication but don't have difficulties with restricted and repetitive behaviour. And this can be very confusing to people, to parents and people with autism spectrum. So again, most people tend to use the label autism spectrum. There's also another subgroup of children who haven't been specifically noted in the diagnostic manuals, but children who have a very high level of anxiety and find any demands that are placed on them very stressful and difficult are often described as having pathological demand avoidance. So there are a number of other common issues which people with autism spectrum experience. So poor coordination and clumsiness, which can be diagnosed as developmental coordination disorder. It's not a key feature of the diagnosis. You don't need to have those difficulties to qualify for such a diagnosis. However, there is a great number of children who also do have these difficulties. Having an unusual gait, an unusual way of walking, unusual mannerisms when walking, perhaps on tiptoes or twiddling fingers when walking, are often observed in children with autism spectrum. Children with autism spectrum might be slow to develop self-care skills and become more independent. Children with autism spectrum may not like cuddling or physical closeness. They may lack a sense of danger and put themselves in harm's way more so than other children. We mentioned sensory issues, including perhaps a lack of sensitivity to heat or cold, and sensory issues can be both hypersensitive, so children might be very sensitive to, for example, loud noises, or they might be under-responsive, for example, to touch, and they might be trying to find ways of stimulating particular sensory needs through, for example, spinning. Other important problems associated with autism spectrum: there's a large proportion of children with autism spectrum who also have an intellectual disability, and there's one study that suggests that this is approximately 35% of children with autism spectrum who have an IQ below 70. Epilepsy is a common co-occurrence in children with autism spectrum, and about 8.6% of children with autism spectrum will also have epilepsy. ADHD, again, is a common co-occurrence, and there's up to 28% of children who might have autism spectrum and ADHD. Tics and Tourette syndrome is another common area of difficulty that some children with autism spectrum experience. There's a high number of children with autism spectrum who have emotional disorders. One study suggests this is around 44%. Anxiety disorders are also common, affecting around 42% of children with autism spectrum. Sleep difficulties are very common with about 65% of children with autism spectrum. Behavioural problems in up to 3/4 of children with autism spectrum, and there's other specific learning problems such as dyslexia that are common in children with autism spectrum. In terms of what causes autism spectrum, that really is the million-dollar question, and in short, there's no clear answer. However, we know there are a number of factors which are implicated. For example, we know that genetics is very important in determining whether a person has autism spectrum. From twin studies, we know that there's a much higher rate of children both having ASD where they have the same DNA. So about 77% of identical twins have autism, whereas in fraternal twins where they don't share exactly the same DNA, this is about a 31% rate of both having ASD. We also know that mutations in genes can occur and genes and the environments interact, and there's a field of study called epigenetics which is looking at this. We know that there are a number of factors that occur when the baby is in the womb which have a role to play in autism spectrum. So things like hormones in the womb can affect how a child develops. We know that there is an increased risk with higher paternal age, and there is a higher risk when there's an exposure to an infection. We know that there's no single cause, and it's a case of there being different aspects of the disorder that may have different causes. It's very difficult and often impossible to identify a cause in any particular individual, and this is very much a rapidly developing area of science, and you can have a look at this website, Spectrum News, which gives up-to-date information in a plain speaking way about all the research that's occurring in the field of autism. Autism spectrum is a relatively new disorder, and children with autism spectrum were first identified back in the 1930s and 1940s, and at the time the zeitgeist, or the spirit of the age, was very much looking at the way that parenting affected children's development, and unfortunately lots of psychoanalysts at the time thought that refrigerator parents were responsible for children with autism spectrum, so parents who were cold and who didn't understand their children's needs. However, this has been widely disproven, and the history of autism spectrum is the history of parents who've become researchers and who have really started to understand this disorder and have moved away from a very blaming or punishing perspective on parents, and much more looking at the genetic and the biological factors which we know are responsible for all these difficulties. And there's a really good book called Neurotribes which you can read, which talks about the history of autism spectrum and how our understanding of it has changed over the decades, and this area where for a long period of time people thought that the parents had a role to play in causing autism has been really damaging. Also, what's been very unhelpful has been the controversy around the MMR vaccine, and this has been widely disproven, and the scientific community are very clear that MMR does not cause autism spectrum, and the drop in vaccine rate has been damaging to children's health in a number of different ways. So you might have heard in the media the epidemic of autism, which is affecting our society, and the truth is that the increase in the amount of people who receive this diagnosis is really due to an increase in understanding of autism spectrum. So what we know now is that social communication, interaction skills are normally distributed, and what this means is that there are lots of people with average social communication and interaction skills, and as you get further away from average, there are very few people with very poor communication and interaction skills, and very few people with very good communication interaction skills. But there are most people are clustered around that average. And where you draw the line between somebody with difficulties in an area and a diagnosis is a really difficult question, and it might involve how much those difficulties affect their day-to-day lives. And there may also be a sense of, we know that intervening early with these sorts of difficulties leads to the best long-term outcomes. So identifying children early and supporting them can lead to the best for them in the future. We currently think that there's a prevalence rate of about 1 to 2% in the population, and there's a lot of debate about how common autism spectrum is in boys and girls. So we think that it's about 4 times as common in boys, but the focus of that is very much changing, and there are some researchers who think that it's much higher in girls, and that we're just not as good at identifying this population. ASD occurs across all socio-economic groups, cultures and countries. So I'm going to talk to you a bit about different theories of autism spectrum. So we're going to talk a bit about theory of mind and the Salian test. We're going to talk about another theory by Simon Baron-Cohen, which is called the empathizer systemizer hypothesis, or sometimes referred to as the extreme male brain hypothesis. We're going to talk about central coherence theory and executive dysfunctioning. So the theory of mind hypothesis suggests that people with ASD struggle to understand the thoughts, feelings and emotions of other people, and it suggests that people with ASD are unaware of other people's mental states, beliefs and desires. In other words, they find it difficult to put themselves in other people's shoes. And a number of experiments have been completed to show that children with ASD struggle with this key skill. There's a role play that's used commonly called the Salian test, where a child watches an experimenter use dollies to illustrate that one person has knowledge that another person doesn't, and can the child understand that? So put simply, one doll is playing with a toy, the other doll leaves, the doll puts it in an unusual place and then goes, the other doll comes back, and the question to the child is, do they look for it in the place where they think it is, or do they look for it in the place where the child has left it? Simon Baron-Cohen developed theory of mind and then went on to develop this empathizers and systematizers hypothesis, and he completed a lot of research and found that men and women have, on average, slightly different patterns of cognitive strengths and difficulties, and he found that people with ASD have an extreme form of this gender difference. So again, if we think about our our curve of what we call normal distribution. So the average in the middle here, and then the further away that you are from the average, the less people are in that region. And those two curves for men and women are very similar, but men on average have different skills and abilities, and people with autism spectrum are an extreme of that finding. And there's also some evidence that the levels of testosterone in the womb contribute to children having autism spectrum. So one way just to illustrate this very simply is to think about the types of jobs that people do, and this again is not a foolproof scheme, and there are lots of people who have a predisposition for being an empathizer or a systemizer who tend to do a job that we wouldn't probably think of as being in that area of expertise, but nonetheless we can think about nurses, software coder, an engineer, an architect, a salesperson, a counsellor, a nursery assistant or a chemist, and what kinds of thinking abilities they would need. So are they better at understanding the way that things work, or are they better at understanding the way that people work? And we can divide this roughly into thinking that empathizers might be more able to read a person's wants and desires, might be able to twist their arm to spend an extra few quid on a new car. A counsellor might be good at reading the signals that somebody is distressed or needs comfort, or is struggling with something that's on their minds. A nursery assistant might be good at reading children's different needs and mental states and emotions and the social information. A nurse might be good at empathizing with patients, might be good at reading the signs that somebody is distressed, for example. And those professionals might be more driven into work contexts where their social skills are more applicable. And on the other side, we might have architects who are very good at understanding the way that buildings are formed and weights, and engineers who really get to grips with how an object works, the forces that are necessary or relevant to that. Chemists understanding the way that different chemicals work and things like medications, and software coders understanding the way that computers work in quite a rule-based way, and reading that much more quickly and being much more able in those areas than someone else. And again, there's an enormous amount of variation, and lots of those people who take up those particular professions will be somewhere in the middle there. But just to try and think about the different skills that people need in different roles. So weak central coherence is an idea that people have a propensity to looking at the detail at the expense of the global meaning. So you can have a think yourself about whether you're somebody who very much focuses on the detail, who really drills down and gets to know something very closely, or whether you're somebody who gets the gist of something and maybe juggles different ideas quite quickly and moves on to different activities more freely and is more flexible in their thinking. And one of my supervisors once described this as in a funny way. They said, that their cat had weak central coherence. So their cat would go out of the front door, see that it was raining, and would go and would check the back door to see if it was raining. So they'd missed the global meaning, that it's raining, and they would just focus on that detail that was raining in one particular place. And you can think about that in terms of, if you were to read a story, one person might take the overall narrative, perhaps somebody going to an airport on a trip, and have got the gist of that, and another person might read that same story and really focus on the fine detail, like they had a leather suitcase, and those differences in taking away meaning are very important in how we think and how we interact with the world. Executive dysfunction is a theory that's used to help us understand restricted and repetitive behaviours and other social behaviours. So executive functioning describes our ability to plan, to think flexibly, to work towards our goals, to inhibit and control our impulses. And you can think of executive functioning as being the CEO of your brain. And these skills are attributed to your prefrontal cortex, which is the most recently evolved part of the brain. And differences in executive functioning are thought to account for some of the differences in the autism spectrum. So if we think about different difficulties in, say, planning and how this might look in a person's day-to-day life, so it might mean that you have to consider how you're going to go to the bank, the library, and then the supermarket. So that ability to be able to think clearly and plan in that way. It might involve problem solving. So if you go to the supermarket and they've run out of cheese, how do you make pizza? Or how do you think flexibly around that problem? It might be about your working memory. So thinking about, I need pizza base, tomato puree, mozzarella from the supermarket. It might be about include your attention. So do you get distracted by the chocolate biscuits which are on sale? It might be about initiation. So asking a member of staff, where's the cheese? It might be about inhibition. Also, can you tell me where the pizza bases are, where the mozzarella is, where the chocolate biscuits are, for example? It might be about perseveration. I need to stop reading this book chapter as they're closing the library. Or having cognitive flexibility. They don't have the book I wanted, they don't have what I wanted from the supermarket. Do they have something similar? Can I buy a similar product? Can I get a different book? And how these different thinking skills interact with how we behave in our day-to-day lives is something that people are still trying to understand. And the truth is that several decades ago, when we were looking at what was causing autism, we might have thought that there was maybe a single gene that was related to a single underlying cognitive process, such as theory of mind, which explains why a child behaved in the way that they do. In fact, the more that we've understood, the more research has occurred in autism, the more that we see this more complex pattern of different genes which relate to different thinking skills, which affect behaviour in different ways. So a much more complicated picture that's much more difficult to unpick. A growing number of people who see autism spectrum as a difference rather than a disability, and quite many adults who have autism spectrum talk about it as being a strength and are keen for us to move away from a deficits model towards a strength-based model. So rather than talking about what you struggle with, what you can't do, where are your strengths, what kind of a thinker are you, and how can you use your skills to contribute something meaningful to society. And people like Temple Grandin, who is an adult with autism spectrum, talks about how different thinkers contribute in different ways. So she made a film about her experiences with Claire Danes, and she talked about how different types of thinkers contribute in different ways. So for example, you need a language-based thinker to write the script, but you need a visual thinker to direct the film. You need people who are technical to understand the lighting, and you need extra technical expertise in, say, the editing process. And it's how each of these contribute to this complex endeavour it is important, and people with autism can contribute in lots of meaningful ways. So these specialists are a company who recruit people with autism for very particular tasks which require a particular kind of thinking style. So for example, there might be a problem in a bit of computer programming for a big multinational company, and all of their experts have looked at it and struggled to find where the error is, and they might call up the specialists who will use somebody with autism who can spot that fine detail in a very effective and efficient way, and whereas it might take a group of computer programmers months to find an error in a code, it might take this particular person with this particular skill 20 minutes to do it. So using people's skills in that way can be very successful, and can help that person to become more economically independent, to contribute something unique to society. And the Specialists is a company that was developed by a parent of a child with autism spectrum, who describes in a talk how people with autism were seen as having skills that weren't helpful, that weren't useful, and couldn't contribute. And he talks about using this analogy as dandelions. So he said there were a group of farmers who noticed that dandelions had some particular qualities and oil that could be produced from them that was really helpful, but most farmers are keen to get rid of these, what they consider to be weeds. And he talks about how this particular farmer was very successful in cultivating dandelions and seeing them for their strengths, and he talks about that with autism, so how important it is to see what people can contribute, what they can do well, and how we need to have this strengths-based approach. And this is a challenge for lots of people in the autism community, for parents, carers, teachers, NHS professionals, etc., to start to think about this in a strengths-based way. And also there's a particular nuance as well to, like lots of people with autism also have an intellectual disability, and they need a greater level of support and help, and they might not have a particular easily marketable skill like being an excellent computer programmer, but they might still have something important that they can contribute, and something that they can do to help society in some way. And coming towards the end of our talk now, really, and thinking about autism spectrum as being defined by difficulties with social communication and interaction, restricted and repetitive behaviours, and we can understand that through the theory of mind hypothesis, which suggests that children have difficulties putting themselves in other people's shoes, reading other people's thoughts and feelings through their behaviour. The empathising, systematising hypothesis, which suggests that males and females on average have some subtle differences in their cognitive processes, and the autism spectrum represents the extreme of that systemizing way of looking at the world. The weak central coherence theory, which suggests that people with autism have the propensity to look at the detail rather than to take the gist of particular information. Executive functioning, which is difficulties with the CEO of your brain, and the planning and problem solving and inhibitions, and that people think differently, and that when we are helping support children with autism spectrum, we need to consider their strengths, and that everybody has different cognitive profile and can make a different contribution. Thank you for listening to my presentation, and if you have any feedback, please feel free to contact us. Thanks.